to better understand TB infections in prisons, the union has set up a dedicated working group to coordinate activity in this area. And I'm pleased to say I'm joined by the Group Chief Health Officer at the Aurum Institute in South Africa, Professor Salome Charalambous, who is also co-chair of the newly formed Union TB in Prisons Working Group. Welcome, Professor Salome.
Hi,
just great to have you here.
Thank you.
We know you're from South Africa, but I think it'd be fascinating to find a little bit more about you, your role at the Aurum Institute, and also about this newly formed group. I know it's been in existence for over a year, but for many people they may not know your role in it and the role that the actual group does.
Okay, thank you. It's such a pleasure to be here and to be part of this Union Live event. I'm a South African doctor. I come from an immigrant family. My parents are from Cyprus, so Cypriot family, grew up in a shop then became a doctor and was working in the mining industry. And through that work I came across TB and HIV, which were obviously very big problems at the time. And at the same time I was lucky enough that the Aurum Institute was being formed, and I actually joined the Aurum Institute as one of the first employees, and was able to really pioneer a lot of the work that we did. TB and HIV research at a time when there was not a lot of research going on, and there was not a lot of funding in that space. But as time went on, PEPFAR and other programs came in, and we started doing HIV and more HIV and TB work, and that's how Aurum survived over. So we're 25 years old now, part of the work that we've been doing has been, because coming from the mining industry, we kind of focused on male populations, and we started then working with a number of different groups that, manufacturers and taxi industry and so on, to understand TB in those populations. And then an opportunity arose for us to assist the biggest prison in Johannesburg. It's called Sun City. Sun City is a making fun name of the place, really.
Yes,
because
it's very well known, isn't it?
It's a big resort in South Africa, but now, of course, this prison is not a resort at all. And we were involved in helping that facility implement antiretroviral treatment for the people with HIV within the facility, because at the time people were going to the neighboring hospital, which was Chris Hani Baragwanath Hospital, and there were all kinds of things going on in between the prison itself and the hospital. So there were a lot of attempts at escapes during that time, and so they were, this was all with armed guards and so on. So it was a terrible situation for everyone. So we then implemented with them the first antiretroviral program within a prison, and that led to many others. So I've been involved in that work now for, I think it must be about 15 years.
So you're perfectly placed then, aren't you, to be part of this Union TB in Prisons working group, to bring all that expertise. And I know you and I've got a similarity. I used to report on Anglo-American, and that's where you started your career as well.
Yes.
So, and we'll come back to the Prisons working group. But let's do a little bit of context, shall we? Why are people living in prison settings particularly vulnerable to TB? And what are the main barriers to effective treatment and prevention in these environments? I mean, I think some are obvious, but maybe some are less obvious.
Yes. I mean, the biggest factor that's really sort of driving TB in prisons is overcrowding. So, many prisons are overcrowded, and we were even hearing this week that, in most cases, even the official percentage occupancy is not really according to WHO standards, for instance. So maybe maybe it will be reported that a prison is 170% occupied, but that's just taking the number of occupants that the government of that country thinks should be in that prison. But if you actually used WHO recommendation, you would probably find it's 300 or 400% occupied, and many prisons throughout the world are overcrowded. So that's the biggest factor. But there are many other factors, because people who are in prison, they come from poor populations. So poverty is known to be a driver TB. And then on top of that, they also come from marginalized populations, so people who inject drugs or homeless people. So all of that then predisposes to TB. So you have like kind of a perfect storm there where there's so many factors coming together. Men are more susceptible to TB than women. So even that, smokers are more susceptible to TB than women, and people who use alcohol are more susceptible. So all of those come together and then drive this TB epidemic. So within prison, many do make really big attempts to try and run TB and HIV programs, but it is quite difficult because there's the problem of not having enough health workforce in a prison, for instance, under-resourced settings. The second is stigma, because often people are living all together, and taking treatment in front of everyone else can sometimes be difficult. And it depends on the environment. Sometimes the environments are really, helpful, and people work together, and there's, they encourage each other. But there's others where it's very difficult, and any reason to be nasty to someone or to separate someone from everyone else will be found. So so they're really challenging environments from that point of view.
And probably one of the challenging environments of the whole TB community, as you said, it is a perfect storm.
Yes.
And that's brilliantly laid out then. So tell us then a little bit more about the Union TB in Prisons working group. How was it formed? I think we mentioned it was over a year ago. You had a first meeting in Paris. And how does it aim to address these unique challenges that you've laid out within the TB in prison populations?
Yeah, so the TB working group is really a group of interested parties, people who all have this passion to try and see what can be done about TB in this specific environment. So, the best thing about it is really the sharing of experiences, because, someone has tried something, generally they've gone against the grain and they've really pushed to try and get something going, because many places, prisons are not like kind of the first place that everyone goes to do work, right? So it's most difficult to get into and so on. So all these people are really passionate about, making a difference within prisons. And so they've tried different things, and our real main aim is to make sure that we can share our experiences. Yesterday we heard about, a really great program that's been done in Indonesia, and another great program that was running in South Africa, for instance. And so learning from each other, but then also being a voice that can then lobby for, people taking it seriously, funders actually putting money towards prison programs, governments acknowledging that these are populations that are very important to TB control, and that they need to put more effort in, and make sure that all the policies are working towards improving TB in prison. Even one small thing is reducing occupancy. I mean, it's in some countries it's really sad to say that people are being imprisoned for drug use, and so they're going to a place where they can get TB, and then once they leave prison, they can give TB to the community, and they go back into prison and they leave, and they go back and they leave. So, so people understanding that link between these facilities and the community is also really, really important. So we're striving to lobby, to gather evidence, to make sure that we share best practices, and to work with WHO to produce guidelines for countries to use, in these environments. Because you can use the normal country guidelines, but there's certain things about this environment that you have to take into account and often have to think through a little bit more. And that's what we hope to be able to bring to the community about TB.
Yeah, and I suppose amplifying the voice internationally.
That's right, yes.
Because it's quite a difficult sell, as you can imagine, for some governments to the general public to make
Very
that
difficult.
case to put money into prisons.
Yes.
But it's for all our benefit, isn't it, as well as the prisoners as well.
In my country, we have an extremely high crime rate. So it's really hard to sell to the public that you want to, make life better for people in prison, because, people feel like that shouldn't happen for criminals, because we all live with this very high crime rate. But they are still people that it's completely unjust to believe that people who steal something need to go to prison, get TB and die. That just doesn't seem like it makes sense, you know.
So looking ahead, what impact do you see that the Union TB in Prisons Working Group could have on TB care and prevention in prisons, and how might its work influence sort of TB global strategies?
Yeah, so what we're planning to do is we're going to be having webinars. So webinars every 2 months where we can share our experiences, as we've said, and discuss certain topics and try and get consensus on what is the right strategy for these populations. So for instance, if we want to prevent TB, what's some of the strategies to prevent TB, what's worked in some places, what hasn't worked, and so on. So, to building that consensus, building that awareness, and then at the same time working with WHO to update guidelines and to create that voice that then goes and lobbies for additional funding as well to be made available to combat TB in prisons. So we think that we would be able to do that as the working group.
Well, thank you so much for coming on Union Live. Professor Salome Charalambous, co-chair of the newly formed Union TB in Prisons Working Group. And we'd love to have you back again on Union Live because I know we're just at the start of this, but thank you so much for joining us.
Thank you very much.